Today we are going to talk about the phases of wound and bone healing in veterinary medicine, what happens microscopically, how long each stage takes, and why the timeline matters clinically. Skin and soft tissue wounds heal through overlapping phases. Hemostasis begins within seconds to minutes. Damaged vessels constrict, platelets adhere to exposed tissue, and the coagulation cascade creates a fibrin clot. This limits blood loss, temporarily seals the defect, and forms a scaffold for incoming cells. Inflammation begins almost immediately, and is usually most active during the first 3 to 5 days. Vasodilation and increased vascular permeability cause redness, swelling, heat, and pain. Neutrophils can enter the wound within about 30 minutes and dominate early, killing bacteria and removing contaminated material. During the next 24 to 72 hours, monocytes arrive and become macrophages. Macrophages remove dead tissue and signal fibroblasts, endothelial cells, and epithelial cells. Infection, foreign material, necrotic tissue, poor blood flow, or repeated trauma can prolong inflammation and delay repair. The proliferative phase becomes evident around day 3 and may continue for 2 to 3 weeks. Fibroblasts build extracellular matrix and deposit early collagen. Endothelial cells create new capillaries through angiogenesis, forming red, moist granulation tissue. Keratinocytes migrate from the edges to restore the epithelial barrier. A clean, accurately closed surgical incision may be covered by epithelium within about 48 hours, while an open wound must first develop a healthy granulation bed and heals more slowly. Myofibroblasts contract the wound. Remodeling continues for months and sometimes as long as 2 years. Early collagen is reorganized into stronger type 1 collagen aligned with lines of tension. Most scars remain about 15 to 20% weaker than normal skin, even when the surface looks healed. This is why licking, running, excessive tension, or premature suture removal can cause dehiscence. Bone healing follows a similar pattern but uses specialized skeletal cells. Most fractures heal by secondary, or indirect, healing. During the first hours and days, torn vessels create a fracture hematoma. Platelets, neutrophils, and macrophages clean the area and recruit mesenchymal stem cells. During approximately the first 1 to 2 weeks, these cells become fibroblasts and chondroblasts, producing a soft fibrocartilaginous callus that bridges the fracture while blood vessels grow inward. Over roughly 2 to 6 weeks, osteoblasts replace the soft callus with mineralized woven bone, creating a hard callus. This requires adequate oxygen, nutrition, blood supply, and mechanical stability. A callus may appear on radiographs before it is strong enough for unrestricted activity. As a broad veterinary guide, uncomplicated fractures may need at least 4 weeks in young puppies and around 8 weeks in adult or older dogs and cats before activity begins progressing. The true timeline varies with age, fracture type, fixation, infection, soft tissue damage, and activity. During final remodeling, which may continue for months or years, osteoclasts remove excess woven bone while osteoblasts replace it with organized lamellar bone and rebuild the medullary canal. With rigid anatomical fixation, some fractures heal directly through primary bone healing, producing little visible callus. Clinically, these phases explain why wounds need cleaning, debridement, moisture control, and protection, why fractures need stable fixation and preserved blood supply, and why recheck examinations and radiographs matter more than outward appearance. Infection, ischemia, malnutrition, unstable fixation, or poor bandage care can interrupt healing at any stage. If you would like to donate to our game and video development, reach out to dogtoursgame@gmail.com.